Educational Communications and this station present Environmental Directions with Nancy Pearlman. On this series, we explore the effects of human influence on the Earth's ecosystems and discuss solutions to environmental problems which affect the quality of life on this planet. Environmental Directions gives you the kind of information you need to help you participate in decisions impacting your community, the nation, and the world. Now, here's your host, Nancy Pearlman.
Hello. For the next half hour, we're going to be talking about a healthy lifestyle with my guest, Dr. Joseph Speidel. He is a board-certified public health physician and is currently senior fellow with the Population Institute. He has been co-director at the University of California, San Francisco's Bixby Center for Global Reproductive Health and is also the university's professor emeritus at the School of Medicine. He has held many positions, including being Population Program Director for the Hewlett Foundation, President of Population Action International, and Director of USAID's Office of Population. And deservingly, he has received many awards: the Arthur S. Fleming Award, the Carl S. Schultz Award, the Family Planning Visionary Award, and the Alan Rosenfield Award for lifetime contributions to international family planning. He has written over 300 scientific publications, and his most recent book is The Building Blocks of Health: How to Optimize Wellness with a Lifestyle Checklist. Welcome. It's a pleasure to have you on the program.
Well, nice to join you, Nancy.
You reviewed over 2,500 articles from medical literature to summarize how people can have a healthy, good life, to avoid the toxics in our environment, to enjoy the toxics that we put into our bodies, and you have provided a lifestyle checklist so that we can learn how to prevent diabetes, heart disease, and cancers, which are so overwhelming in our American society. Your chapters in your book are so informative because you have reviewed so many studies. And you don't have to read this book from cover to cover. You can pick and choose as one wants, whether or not you want to learn about cancer or dementia or osteoporosis, or reproductive health. When I read the book, it seemed to me that almost every kind of condition that we have that has caused health problems can be corrected by a healthy diet and exercise. Did I read that correctly?
Well, those are key of the building blocks of health. One of the key takeaways from my book is that most Americans don't seem to know exactly what they should do to protect their health, and they're certainly not doing it. I looked at what proportion of Americans really approach what you might call an optimal health, and it's less than 5%. Americans have evolved a lifestyle that is basically toxic to our health. We're overstressed, underexercised, we're overfed on a red meat-based, high saturated fat, high sugar, high salt, processed food diet, and we end up overweight. And furthermore, we misuse tobacco, alcohol, and other drugs. One of the key takeaways is you can't rely on doing just one thing, like getting a lot of exercise, or avoiding just one thing, like one risky behavior, like not smoking, to get and stay healthy. Multiple factors are at work to make us sick or keep us healthy. There's many factors, and that's why I wrote a book with all those chapters, because each of them, in a certain way, contributes to better health.
And you are very involved in preventive health, in preventive actions, because you decided that it was better to work for prevention than to try and cure illness.
That's right. When I actually had patients to take care of, especially in the hospital, I treated many patients with preventable diseases. For example, heart attacks at young ages. And it became clear that somehow we were not doing as well as we could to prevent. We have got a great healthcare system after you get sick, but we're not doing nearly as well to keep ourselves healthy. And I think one reason is doctors don't have enough time to spend educating their patients and helping them get onto a healthy lifestyle, which is another reason that I wrote the book, to help patients take care of themselves. It's certainly much more efficient and better to stay healthy than try to pick up the pieces after some damage is done. Another fortunate thing, however, is, though, when you stop the damaging behaviors, that are harming our health, the body has enormous capacity to heal. In other words, it's, for example, you've smoked for many years. It's not too late to stop. Several years after smoking, much of the risk of smoking, which causes heart disease and lung disease and cancer, much of that risk dissipates. It's something that people of all ages can take on and should take on. As you implied, we could prevent 90% of diabetes, 80% of heart attacks, and nearly half of cancers. Cancer is a tougher one to prevent because there's a lot of causation of cancer that's just random errors in replication of tissues as they reproduce. So that one is more difficult, but we can do a lot. And there are things that we can do to prevent cancer that we don't think about. Most people don't realize that getting exercise helps prevent cancer, that staying in normal weight, avoiding overweight and obesity prevents cancer, many kinds. While we're speaking of obesity, one of the sad things is that 40% of Americans are obese, and about 30% of us, only 30% of it, are able to maintain a normal weight.
You mentioned that an optimal lifestyle can help avoid disability, possibly add 10 to 15 years to life compared to not doing all the healthy things, and that is eating well, because the American diet, unfortunately, is generally unhealthy with too much saturated fat and meat and salt and added sugars and calories. But you mentioned that with that lifestyle, if you both have a better diet and exercise, you can lose weight, you can look better, you can feel more energetic, you can sleep better, you can avoid some major illnesses like heart attacks, cancers, and strokes, and even mental disability like depression. It seems like everybody should be wanting to live a healthy lifestyle.
Well, obviously, I think that's true. The benefits really are quite amazing. Each thing you do to stay healthy adds to the other, that long list you just mentioned. So there's only an upside and there's no downside. I suppose the downside may be that you have to give up a few things that you may like, or some things that are harming your health, like abuse of alcohol and other drugs, which some people find very hard to resist. It's sad that there's still 30 million of us who still smoke, and that is a hugely damaging activity.
While some aspects of one's lifestyle one can control in terms of smoking or alcohol or drug use, it seems as though there are other factors that can harm us that we don't have so much control. That's the environmental pollutants and toxins that we confront all the time. I live on a very busy street, didn't used to be, but seems to be more traffic every single day, and that's more air pollution, and I'm sure it's harming me, isn't it?
Unfortunately, it probably is. Something like 85,000 or more chemicals out there, and most of them have not really been adequately tested for health. The United States does not abide by the precautionary principle the way they do in Europe, which means you need to, before putting something on the market and using it, it needs to be tested for health effects. We just kind of throw it out there, and we do have the ability to review things. Even though the Environmental Protection Agency can do a safety review, they're overwhelmed. They just can't take on a huge number of compounds. So it would be better if we required the manufacturers to first prove they're safe before putting them on the market or putting them into use.
Let's explore what is happening with these chemicals, because 85,000 chemicals are a lot to be out there. And as you pointed out in your book, the companies that make them don't have to prove that they're safe, and they're not regulated or removed from the environment until they're proven to be unsafe. That seems to be the backward way of doing it.
Well, that is the way it is. There's a similar backwards way of doing it with food additives or vitamins and minerals that are dietary supplements. They are not FDA approved, and just as all those chemicals are not EPA approved, the things we eat, we assume may help our health, are not proven to be beneficial either.
As an environmentalist, I am very concerned about the pollutants in our environment and how it affects our health. Are we going to be able to clean up the toxics and the pollution in our environment so that we stay healthier?
I think there are many examples of doing better with regards to the toxics in our environment. There's some big success stories like ozone and DDT, which demonstrate that it is really possible. I mean, DDT is an endocrine disruptor. We've done well with a few things, and we should probably adopt what the Europeans have, the precautionary principle, where we test things before we use them rather than identifying the harms they cause after they harmed people. We can eat more organic food. We can grow more food organically. We should crank up research so that we really know much more about the risks and benefits of many of the products that we use, whether they're pharmaceuticals or metals or chemical compounds or pesticides or whatever they are.
You mentioned that there are thousands of chemicals introduced into our environment, our foods, products, and they're not tested for safety. What kind of legislation do we need to change that? Because to me, the companies should prove that they're safe before they are allowed to use them.
Well, we have now implemented some better regulation, which gives the EPA the ability to step in and require more testing of risks and benefits. But they're not really able to look at the huge number of chemicals out there. So strengthening the ability of our EPA to step up and use the legislation that exists would be a first step. In addition, we could strengthen that legislation to make sure that we review things before they're put into a product.
You had a chapter talking about vitamins and supplements, and you reviewed the scientific literature and pointed out that a lot of the supplements out there really don't do anything. People are wasting their money, and even vitamins are not necessarily something that we need to be taking all those extra vitamins.
Let's just look at the supplement industry. It's a $50 billion a year juggernaut, and 2/3 of adults over the age of 70 use some kind of dietary supplement. There's 90,000 different ones out there. Now, even though the FDA has the ability to take unsafe ones off the market, they don't have the manpower or the mandate to regulate them. And it would be much better if the FDA required a supplement maker to prove they were beneficial. All you have to do is turn on television, and you'll have many totally unfounded claims that are misleading the public. It's really sad that people are wasting their money. And in fact, many, if not most of these supplements are damaging to health rather than helping you. Even vitamins in extra high doses are harming people's health. And there's evidence that really high doses have caused increases in cancer, heart disease, and even deaths. Things like sports drinks are thought to be healthy, but in fact, they too have problems. One figure I saw was something like 23,000 emergency room visits per year based on some dietary supplement. And just this week, there was a congressman's wife died from some plant-based supplement. So these are things that are not regulated, and basically they should be avoided. In fact, if you need a vitamin or a supplement, it should be something recommended by your doctor, not something you decide, oh, I'm going to try that out just because you think it might be helpful. Unfortunately, you can't believe the advertising that claims it's healthy.
You have so much incredible advice, background, data to support your positions to live a healthy lifestyle in your book, The Building Blocks of Health, How to Optimize Wellness with a Lifestyle Checklist. I'd like to cover more of some of the information that you are providing to the public when we return in a moment with my guest, Dr. Joseph Speidel.
Environmental Directions with Nancy Pearlman continues with further discussion of the world's critical ecological issues. For more information, you may call 310-559-9160 or go to www.ecoprojects.org. Now, here's Nancy.
I'm speaking with Dr. Joseph Speidel, a board-certified public health physician, senior fellow with the Population Institute, and author of The Building Blocks of Health, How to Optimize Wellness with a Lifestyle Checklist. For every condition that you described, whether or not it was cardiovascular disease or weight control, dementia, cancer, infectious diseases, reproductive health, you kept coming back to some basics Avoid tobacco. Reduce your intake of alcohol. Avoid being overweight and obese. Be physically active. Eat a whole food, plant-based diet high in fiber, fruit and vegetables. Avoid refined grains and added sugar. At least limit red meats. Eliminate processed meats. Avoid high heat cooking of high protein foods. And protect your skin from the sun. Limit the CT scans and x-rays, as well as avoid hazardous home and workplace exposures. Let's go back to those issues of home and workplace exposure. How do we make sure that our indoor buildings are safe for us?
As we've been discussing, the risk of many of these compounds that are in our lives every day are not well known. So the safest thing to do is avoid as many of them as possible. For example, if we want to clean things in our house, there are things like vinegar, baking soda, and just plain soap and water. We can avoid all of those other things that are being sold, and especially ones that you can breathe, I would avoid. With regard to food, if you get fresh or frozen food, it's going to be probably safer than other forms of food, especially the processed foods that make up so much of our diet. Even canned foods may have some risk, although that's uncertain. It's impossible to avoid all risk, but we can at least minimize it, and we should avoid things that we put in our body. We've already talked about vitamins and supplements, and especially don't inhale things, whether they are smoke from a cigarette or mist from something that you're spraying on yourself or spraying around your house. We can also avoid pesticides. If you have pets, don't put pesticides on your pets. Not good for them and not good for you. As far as air quality goes, keep track of the air quality index. Anything over 150 is unhealthy. The scale runs 0 to 500, but in a world full of wildfires and car exhaust, it's hard to avoid, but you can do the best you can. So we can't all live totally free from risk, but we can minimize it.
In addition to your work at the University of California, San Francisco, in their School of Medicine, you have held other positions, including being Population Program Director with the Hewlett Foundation, President of Population Action International, Director of the United States Agency for International Development's Office of Population, and you really are an expert in reproductive health, sexual health, population, and in being concerned about overpopulation. There's sort of two issues here. How do we take care of our sexual and reproductive health, and how do we deal with the larger picture of overpopulation on the planet?
That's a big question. Individual sexual health, a lot of that depends on knowing what to do and behavior. Safe sex is one thing that we can all do. With regard to population growth, we're about to hit 8 billion people. We're adding about 90 million people every year, which is a huge number of growth. The percent of growth has come down, but we're still adding a lot of people. We know about half of women on the planet still do not have really high-quality access to family planning programs. That's something that we could do something about. Now, I used to work for USAID, and we were the number one purveyor of assistance for international family planning in poor countries. But the budget for that program has been kind of stalled. It's really pretty low. There are a lot of other organizations that could help working overseas on high fertility. If fertility were high because it's what people wanted, that would be one thing. But most couples want to limit their fertility. Even in high fertility parts of the world like Africa, there's unmet need for family planning.
You have worked internationally, and you see, as a doctor, so many conditions that are preventable and that can be cured here in the United States, but over in places like Africa, Asia, and South America, people are still suffering from many conditions that we have rather eliminated because of vaccines like polio or waterborne diseases that we have our water tested. What are some of the current medical problems that are still out there in the environment in other places, or even here in the United States? Do we have safe water?
In general, we do have safe water, especially compared to the poor countries overseas, which are doing much less well. One thing that we should keep in mind is that the countries that have gotten out of poverty have been able to improve the health and welfare of their populations, usually have cut the birth rate. If you're rapidly growing, you have to invest in increasing access to basic human needs rather than being able to improve their quality. And so you're basically running very hard just to keep up with the population growth. That's the problem in many countries in Africa right now. Other countries that have helped men and women control their fertility voluntarily, no pressure, but given them the means, where birth rates have dropped and the population growth rate has slowed down and economic development has taken off. And that could happen in many other countries.
In the United States right now, there are two major controversial issues. Do you have any comment regarding the abortion and the vaccine debates going on?
Yeah, let's start with vaccine hesitancy. I think it's mainly based on misinformation. And the overwhelming data demonstrates that vaccines have been an enormous boon to health. Occasionally, there may be unpleasant side effects to some vaccines, but usually they're very limited and very minor. And I think vaccine fear is a strange thing based on misinformation. Unfortunately, there's a whole industry out there spreading this misinformation. Now, vaccines are not guaranteed to protect everybody perfectly. We know that. But the odds are in your favor are dramatically increased through vaccines. And vaccines are how we got rid of smallpox, how we've largely eliminated polio, and they can make a dent in other diseases. One shouldn't be afraid of vaccines. With regard to reproductive rights, I don't think the government should force women to have children against their will. Unintended pregnancies or pregnancies with damaged fetuses, which would not be survivable, these are conditions where women should be allowed to make up their own mind, in my opinion.
We've been talking about physical health issues, but let's not forget the mental health. It's really coming to the fore as we have a lot of mentally ill people who are homeless, who I read about every day attacking somebody. We have older people with dementia and Alzheimer's, and we don't have the institutions anymore to provide the services, the aid and the support. Are these conditions due to poor health and poor lifestyle choices of eating poorly and not exercising?
That's difficult to determine exactly what leads to mental health issues. One thing to keep in mind is that most mentally ill people are not harmful to themselves or other people. One key thing, of course, is people who are ill mentally should seek help. There are many, many facilities out there, although not enough. That's number one. And we have various technologies, behavioral health interventions, and we have drugs which may help people. So there's a lot that can be done for mental health, and certainly we're not doing it today. That isn't an intractable and extremely difficult area in which to work.
I mentioned at the beginning of the interview how your book has summarized over 2,500 articles. And while I did read all your chapters, and it's about 400 pages of very detailed information, summaries of charts, you don't have to read it constantly. You can pick and choose, read a page or two, look at the charts, look at the numbers that we should be paying attention to. You have so much valuable data. I didn't exactly read the last 100 pages, literally, of all your references. You are not making this information up. You are taking information from so many different sources. How did you do that research?
Well, I subscribe to some of the leading journals, like the Journal of the American Medical Association and the New England Journal of Medicine. They often have review articles which are extremely helpful, and then they will list a number of key references that you can look up. And then thanks to search engines on our Google Scholar, one can find a whole lot of information. And the medical literature is gigantic. I may have referred to more than 2,000 references, but that's a tiny fraction of what's out there. And I'm sure I missed things. And I'm sure there are things that some experts might disagree with. But I tried to summarize. I tried to make everything I suggested based on science. And unfortunately, in today's world, we're seeing a lot of advice about medicine and, interestingly, criticism about how the COVID-19 epidemic has been handled by people who don't really know what they're talking about. I think it becomes very ideological.
For each issue that you tackled, you provided lots of data in charts and tables that showed us what our level of this item should be or that item should be. But you wrote it for the layperson, not just for the medical doctor. It's really good, valuable information for both.
Yes, I think you have the ability to get in as deep or as little into each issue as you want. And each of my chapters, whether it's cardiovascular cardiovascular disease, our cancer, our physical activity, our mental health. I have a one-page summary at the very end. So after you've read the chapter and gotten a lot of information, I've got a summary for you that makes it easy to get a grip of, I hope.
It really helps. I mentioned some of the suggestions that kept coming up, regardless of the health problem, how to perhaps make one less likely to get those terrible health issues, and perhaps you would like to sum up what one should do to have a healthier life.
Okay, one basis is healthy nutrition, and that means whole food, plant-based nutrition, avoiding saturated fats and highly processed foods, getting plenty of physical activity. The experts say that benefits begin at about 150 hours per week. Actually, they begin at any exercise, but about 150 hours a week of moderate physical activity or 75 minutes a week of vigorous physical activity, you get most of the benefits from activity, avoiding overweight and obesity, and the key to that is getting plenty of exercise and avoiding added sugar to your diet. Interesting, people who have lost weight and kept it off, many of them find they have to get a lot of exercise to keep the weight off. Unfortunately, that's what it is. But that 150 minutes a week, that's a little more than 20 minutes a day. And people who say, well, I don't have time, keep in mind that Americans are watching 5 hours of TV every day. If you can't spend 20 minutes or so for exercise, then you're making a mistake. And, of course, avoiding alcohol, tobacco, opioids, and other drugs is extremely important also.
You reviewed so many scientific documents and covered so many aspects of a lifestyle. What was most surprising to you, someone who's been in the medical field for decades?
I found most surprising the fact that you have to do multiple things to get healthy, that each one of those adds to your risk if you're not doing it and adds to your better health if you are doing it. In other words, you can't just do one or a few things. You need to do quite a few things to stay healthy.
Everyone should have this book to use to improve their health and their lifestyle. How does one get your book, The Building Blocks of Health, How to Optimize Wellness with a Lifestyle Checklist?
You can look at the booksellers like Barnes & Noble or Amazon, and I think Apple Books. Well, the easiest way to get it would be just to go to my website, which is jjspeidel.com. That's JJSPEIDEL.com. Most booksellers will have it. My blog is also at that website, and the blog is taken from the book. So you can get a small taste of what the book is like looking at my blog.
I want to thank you so very much for providing such wonderful guidelines, how to take care of our health, have a healthier life, and providing this superb reference book that I'm going to keep looking at chapter by chapter, page by page to review and to take care of my health. Your book, The Building Blocks of Health, How to Optimize Wellness with a Lifestyle Checklist, is excellent. Everyone should be using this as a reference guide for a healthy life. Thank you so very much for writing it, making it available. Thank you for being my guest.
Oh, it's my pleasure. Thank you, Nancy.
I have been speaking with Dr. Joseph Speidel, a board-certified public health physician and senior fellow with the Population Institute and professor emeritus at the University of California, San Francisco's School of Medicine. I'm Nancy Pearlman. Thank you very much for joining us, and do tune in again next week.
If you would like free information about these environmental issues, go to www.ecoprojects.org or call 310-559-9160. Environmental Directions with your host, Nancy Pearlman, is a community affairs program of the nonprofit organization Educational Communications and this station.